Complete movement restrictions led to increased depression and stress among migrant workers, and those who feared for their health and job or were more exposed to COVID-19 rumours also reported so. That's according to a survey of over 1,000 low-wage migrant workers from June to October last year, when many COVID-19 restrictions were still in place. It was conducted in hopes of identifying and supporting those at risk of poor mental health. Researchers say that even though migrant workers showed resilience as a group, those predisposed to poor mental health may have been adversely affected by pandemic-related factors, resulting in more suicide attempts among them. For more, we're joined by the study lead, Assistant Professor Jean Liu from the Yale-NUS College. Professor Liu, your study found that depression and anxiety levels among migrant workers were similar to that of the general population, despite their considerable vulnerability. Why is that so?
Yes, that's true. On the whole, migrant workers didn't have higher rates of depression, anxiety, and stress. But at the same time, I think it's really important to emphasize the other findings that you talked about. In our study, migrant workers confined strictly to their dorms fared poorer. If they were really afraid of losing their jobs, about their health, or if they were exposed to more rumors, they fared worse. And workers diagnosed with COVID-19 were also very anxious. So it's really important that we talk about these vulnerabilities amidst the population's resilience, particularly because these are risk factors that can be modified.
It is important that we have those conversations, Jean. And what are the key difficulties in perhaps identifying migrant workers who might be suffering from poor mental health?
I think one of the things that we noted when we went into our study is that the best tools that we have in our trade are often in the wrong language, or they may not be culturally appropriate. So somebody may want to be very stoic when they're struggling, or they could tell you that they have a stomachache when they're really depressed. It's very hard to pick out mental health symptoms in these cases, and we don't have the right tools for the job often. So we need to work harder to bridge this gap.
And as Singapore transits into a COVID endemic world, what sort of support should stakeholders chip in with, especially for migrant workers new to the city?
First, we've seen how movement restrictions can come at the cost of poor mental health. So I think just as we're moving away from these restrictions in the community, we need to prioritize other safe management measures for the migrant worker population. Second, Singapore now has a task force to address the mental health of migrant workers. So this task force brings together stakeholders from the Ministry of Manpower, Institute of Mental Health, and migrant worker groups. It's in the right direction and could go a long way in bridging the language and cultural gaps I pointed out earlier. So we should support these efforts.
And beyond what we're seeing with migrant workers, Professor Jean, how can we use this data to now perhaps support other vulnerable segments of the population?
I think there are two populations that I want to talk about in terms of vulnerability. First, worldwide, there are 164 million migrant workers working in different industries. Since the pandemic began, COVID-19 outbreaks have occurred in Malaysia's rubber glove industry, Thailand's shrimp markets, Taiwan's factories. Our findings are very important for any migrant worker group who works or lives in a place with high densities of people. But the other form of vulnerability that I want to talk about is that we can actively search for the risk factors. Are there people in our community afraid of losing their jobs? Are there people who have poor health to begin with or are really afraid for their health? These are the people most likely to struggle during the pandemic, and we can reach out to them proactively.
It's that reaching out that's important. Thank you so much, Professor Jean, for joining us this evening. Assistant Professor Jean Liu from the Department of Social Sciences at Yale-NUS College.